On this edition of Open for Debate, we ask how a scientific breakthrough called CRISPR-Cas9 can change the future.
From superfoods to superhumans, we explore the potential innovations
and possible consequences of editing human genes.
Join our conversation with Berkeley scientist Dr. Jennifer Doudna to discuss her co-discovery of the world-changing genetic technology, CRISPR-Cas9.
Thank you for joining us for Open for Debate, co-produced by the Lafayette College Policy Studies Program and PBS 39. I'm Hannah Doherty.
And I'm Natalie Gosnell. In this episode, students explore a scientific breakthrough in human gene editing known as CRISPR-Cas9.
We begin with an exclusive interview with one of the scientists who discovered this technology, Dr. Jennifer Doudna from the University of California, Berkeley.
Doudna has received a long list of academic awards and a place on the Time 100 Most Influential People list. She's frequently mentioned as a potential Nobel Prize winner.
Reporter Danielle Wolf and I interviewed Doudna about CRISPR-Cas9 at the Franklin Institute in Philadelphia. Thank you, Dr. Doudna, for joining us today. Genomic engineering has been around for decades now. What makes CRISPR-Cas9 so different?
The CRISPR technology is a relatively new way to make precise changes to the DNA in cells and organisms. And what makes it different than earlier technologies is that it's simpler and easier to use. So I like to call it a democratizing technology. It makes precision genome editing available to labs around the world that have a skill in molecular biology.
So in the beginning, you discovered this technology in bacterial immune responses to viruses. So when did you realize that you could apply this to the human genome?
I think the wonderful backstory to CRISPR is that it's a technology that came out of an effort to understand a fundamental process in biology, which is how bacteria fight viral infection.
Does it work the same way in humans?
It does. It works the same way in humans. So it's able to find and cut DNA sequences that match the sequence of the RNA molecule that it's programmed with.
CRISPR technology literally has the ability to change the genetic code of a human life. For someone who's considering this technology, what could go wrong?
Well, lots of things could go wrong. You know, the change could have an unintended consequence. That would be one possibility. Also, the change could occur at an undesired place. You know, so there could be a sort of so-called off-target editing that occurs. That's sort of collateral damage, you could call it, I guess. So there's that possibility. For every application, we're going to have to balance the risk versus the benefit to decide if it's worth doing.
Right now, there's a lot of speculation on what it could do. We want to know realistically, in the next 5, 10, 20 years, what it can do.
We published our work in 2012, and we're now in 2017, so it's only a 5-year-old technology. And this is sort of a remarkable thing to see how fast it's been adopted for various applications. And right now, there are already clinical trials that are starting using the CRISPR technology to treat cancer patients. So that's the first step. But I think I'm thinking in the next probably 1 to 2 years, we will see clinical trials beginning for treating genetic diseases like sickle cell disease. And then beyond that, I think, if we talk sort of maybe 5 to 10 years out, we'll start seeing clinical trials for other genetic diseases, such as muscular dystrophy and possibly even cystic fibrosis.
When do you think it will be applied to more genetically complex diseases?
Yeah, it's hard to say. I mean, I guess there I'm thinking we're probably looking out a decade or so. I could be wrong because I've been amazed at how fast the pace of research has been moving over the last few years. So certainly things are moving quickly, but I do think that it'll be a lot more challenging to treat diseases that have multiple genetic defects.
We'll share more from our interview coming up. But first, how exactly does this technology work?
Doudna describes the science in this animation provided by UC Berkeley.
The CRISPR-Cas9 system has an amazing ability to recognize a particular DNA sequence in a cell that may be malfunctioning and then disable it by cutting the DNA. We call this gene editing, and we can use it to disable or repair a mutated part of the gene which may be causing disease. For Cas9 to find the malfunctioning DNA, we attach it to an RNA sequence that matches the DNA sequence we want to edit. Then we put this RNA-Cas9 combination into the cell. It finds the mutant DNA and uses a chemical reaction to cut the DNA strand right at the spot where it's malfunctioning. After that, we can sometimes insert the correct version of the gene for the cell to work properly again.
Despite its potential benefits, CRISPR has attracted criticism from some religious perspectives.
According to a survey conducted by the Pew Research Center, 66% of highly religious Americans oppose using gene editing to give their baby a much reduced risk of disease. To discuss the tension between religion and science, we met with Stephen Lammers, Professor Emeritus of Religious Studies at Lafayette College. He says the CRISPR debate brings up two important questions for Western Christians.
Some members of the religious community are suspicious that they need it for the wealthy and the advantaged and not the disadvantaged. So that's one question. The second question is, so who's going to keep an eye on them?
Pastor Charles Lawson of the Temple Baptist Church in Knoxville, Tennessee, expresses similar concerns regarding how the scientific community will handle the application of this technology.
They're getting into something that is Pandora's box. This is getting into the actual DNA and the ability to reprogram DNA to program desired intelligence, appearance, things like that into future generations.
The religious community does not want to see the medical community take advantage of life-saving technology for life-changing technology. For Lafayette College, I'm Lauren Hughes with Corinna Anderson and Bowden Saunders reporting.
Applications of CRISPR technology raise a host of ethical questions.
Reporter Amanda Case asked University of Pennsylvania medical ethics professor Jonathan Marino to explain some of the biggest issues that he sees ahead.
Dr. Jonathan Marino, professor of medical ethics at the University of Pennsylvania, is a prolific scholar in the field of bioethics. He's had a key voice in the debate surrounding CRISPR. Marino says the use of CRISPR, while easy, has bioethical implications. It's constructive to separate the ethical concerns about CRISPR into two types: editing somatic cells, which only affects the individual organism, and germline engineering, which according to Dr. Marino is the top priority.
I think what worries people is the possibility that we could modify every one of our descendants according to our dictates. And that's called germline engineering, and CRISPR presents the opportunity to modify our descendants in some systematic way. For example, if there are some serious diseases that could be eliminated from all of my descendants' germlines that I'm carrying in my DNA, you could do it safely and predictably, then there might be a case for taking serious diseases out of your germline.
Another widely voiced concern is the inability to control the outcome of CRISPR-modified organisms.
First of all, there are big questions about what the larger effects would be on the organism. You take one thing out, something else may change. Also, a lot of the negative traits we have, disease-disposing traits we have, also protect us from other diseases. You and I are not what we are just because of our genes. We are what we are because of the way our genes interact with our environment.
For Lafayette College, I'm Amanda Case with Bowden Saunders reporting.
Research using CRISPR-Cas9 has many potential applications, including for multiple myeloma, a type of cancer.
More than 2 decades after her diagnosis, Kathy Juicy still remembers when doctors told her she had a blood cancer known as multiple myeloma.
The doctors gave me 3 years to live at best. And I could have pulled the covers up over my head, but our daughter Nicole was just 1 year old. And I knew I had to fight as hard as I possibly could.
Myeloma is considered fatal, so Kathy founded the Multiple Myeloma Research Foundation, or MMRF.
I felt that if we were able to fund research, that we would move the survival from the dismal 3 years that were given to patients at that point in time.
She hopes technologies like CRISPR-Cas9, working towards sharing genomic information and finding treatments, can bring people the same happiness Kathy has found in the past 25 years.
And it brings moments and hope. Just in the past couple of years, I can think I have seen a 25th wedding anniversary. That little 1-year-old girl, Nicole, has now graduated from college. Our son David, son we never ever expected to have, is living his dream.
For Lafayette College, I'm Kyle Johnson with Natalie Gosnell, Katie Kidder, and Spencer Rouse reporting.
For many inherited medical conditions that remain uncured, such as cystic fibrosis, CRISPR provides hope for a cure.
We met with Sean McCooey, a senior partner at McCooey & Associates, and an active member in the cystic fibrosis community with extensive professional and personal experience.
My sister died at age 12 when I was a sophomore in high school.
Cystic fibrosis is an inherited life-threatening disorder that damages the lungs and digestive system.
Having CF, she had to do daily regimen of medicines, of aerosols, and of chest physical therapy.
Therapies have drastically improved since Sean's sister was treated, but a cure has still not been found. The cystic fibrosis community supports new therapies and innovations that aim to find a cure. For example, the Cystic Fibrosis Foundation recently awarded a $5 million grant to Editas, a discovery phase pharmaceutical company.
And what they've done is because they have such a database of genes and database of cells and database of tissues, they're offering that to this company Editas to facilitate this collaborative research.
McCooey remains cautiously optimistic about the prospects of CRISPR-Cas9. For Lafayette College, I am Jason Sands with Charles McCooey, Jinzhou Zhang, and Jishou Zhang reporting.
To find out how potential patients feel about using CRISPR, reporter Sean Menarguez sat down with Gianna Yort and her mother to discuss their thoughts.
14-year-old Gianna Yort was diagnosed at 9 months old with a genetic condition called oculomotor apraxia, which inhibits the ability for the eye to focus.
They told us it was 2 recessive genes. There's no history in our family. When a baby's born and their eyes have trouble focusing, she never gained that focus. She learned to compensate, and as she got older, it got better.
Could CRISPR-Cas9 be the key? We asked Gianna what she thought about the new and upcoming technology.
I don't think the technology should fix any disabilities, but I think the technology is good for like sicknesses like cancer and stuff, but not disabilities.
Over time, Gianna's mother began to feel the same way.
At that point, my 9-month-old baby, I probably would have jumped at it. But now, fast forward 15 years, and as Gianna said, has the challenges been that bad? Actually, we took them in stride. So she can't ride a bicycle. Is that the end of the world?
Gianna left us with her final thoughts on her condition.
I believe that I look the same like anyone else and succeed like anyone else. I didn't feel like I was different.
For Lafayette Lens, I'm Sean Menarguez with Mike Giacco, Austin Drucker, and Lee Zhang.
For patients hoping to benefit from CRISPR technology, reporter Michael McCormack asks how much will it cost and will insurance cover it?
According to Intellia, a major firm developing CRISPR, coverage from insurance companies will be vital for the success of CRISPR. We spoke with Ann Baum, Lehigh Valley Executive and Vice President of Capital Blue Cross, a part of an organization that insures more than 100 million people, to find out if they will cover CRISPR.
We make our decisions based on what's considered medically appropriate. When things are considered medically appropriate, then we tend to cover them as part of our policies.
The costs for therapies using CRISPR are hard to estimate, but Ms. Baum explains how CRISPR could affect healthcare costs over time.
I think what you'll see, and we have seen it, is as new cures, like the hepatitis C drugs, those are really expensive, but it was a treatment for something that was not treatable before. So yes, there's an injection of high cost, and then it kind of becomes part of the system. I think the same holds true for this CRISPR technology.
For Lafayette College, I'm Michael McCormack with Bowden Saunders reporting.
Here's more from our exclusive interview with Jennifer Doudna,
starting with how existing regulations could apply to CRISPR. Can you point to any public policies, either current or prospective, that are relevant to the development of this technology?
Yes, we're fortunate that there actually is a very nice framework in place for managing and regulating the use of technologies like the CRISPR gene editing tool. Part of this comes from the work that was done back in the 1970s in a meeting that's known kind of in the scientific community as the Asilomar meeting that happened back in 1975 to discuss molecular cloning. And that meeting led to a series of discussions and eventually regulations put in place to monitor and guide the use of technology that would allow DNA to be copied and to be put into other organisms. And so we're able to operate under the same guidelines for this technology as well.
What commercial application of CRISPR are you most excited to see?
Well, I think, again, this gets back to what we talked about earlier with, in terms of thinking about where it's going to have the biggest impact. And I do think that when we think about agriculture, this is an interesting thing where, we can think about an impact on many, many people that avoids the whole question of, access to insurance and things like that, right? If we have ways of developing plants that have higher nutritional value or can grow better in certain environments, I think that's something that could be extremely impactful on human health.
CRISPR has the ability to change certain aspects of people's lives, such as preventing allergies or color blindness. Where do you think the line should be drawn between life-saving aspects of CRISPR and life-changing uses?
Well, for myself personally, I think that I'd like to see this technology deployed initially, at least, to understand the human condition better. Understand our own genomes. Remarkably, we still don't understand that much about the information that's encoded in our own DNA. So this is a tool that will clearly going to accelerate that. And then beyond that, I think in terms of thinking about applications across different conditions that will affect human beings, I personally would like to see it used to help treat or cure genetic diseases, things that we talked about earlier.
You don't believe people should go there, but many people have been discussing and associating the CRISPR technology with designer babies and super athletes. How legitimate are their concerns?
Well, I think they're legitimate, because I think we're now really for the first time in human history, human beings have the ability to alter their own DNA in a way that could affect human evolution. I mean, it's kind of really profound to think about that. And even though there are practical restraints on that we've been discussing, it's a very real possibility now in the not distant future. So this is why I think it's critical to be, educating the public about this, encouraging people to think about it and to get involved. That this shouldn't be something going on behind the walls of research laboratories, but it really should be something that all of us as part of the human community should be discussing, because it really belongs to everyone.
One more question. What criteria will you use to decide whether or not others can license your patent?
Well, it's not up to me, actually, because the work that we did is owned by the University of California. So the University of California, as a public university, is responsible for licensing those patent rights and deciding, which commercial operations will get access to the technology. But I do want to point out that, the technology is freely available to anybody that's working in academia. So anybody doing not-for-profit research is freely able to access this, and I think that's one of the things that makes it so exciting, is that we just see it being adopted globally, really, for all sorts of applications in research and technology.
Thank you, Dr. Doudna, for joining us today and for your expertise.
It's been a pleasure to be here.
As the potential benefits of CRISPR continue to grow, so does the importance of the patent rights.
The contentious legal battle between the Broad Institute and the University of California, Berkeley has been in the news since 2012, with a recent ruling granting patent rights to the Broad Institute. To gain insight into the patenting process, we talked to intellectual property attorney Scott Bluhney.
The CRISPR technology is a much sought-after technology for patent protection. A number of parties have sought patent protection on it. Although they have similar technology, what they're claiming in their patent applications is their inventions do not overlap. As a result, both parties may independently seek patent protection on their specific areas.
Although on the surface it appears that this issue is between the Broad Institute and UC Berkeley, Bluhney maintains that there are many other parties involved in this dispute.
It represents a very exciting technology, and perhaps breakthrough type of technology. So there's a lot of investment into the technology, and there are a lot of parties that are seeking patent protection as a result, both academic institutions and commercial institutions, and there are a number of commercial licenses that have been taken to the various patent applications and patents that have been filed.
This left us wondering if patents are the most secure way of maintaining full control over one's invention.
Well, I think the key is protectability. If a technology is protectable in the form of intellectual property, it is meaningful for the company seeking to commercialize it, because for them that means they don't have to worry as much about the competition.
For Lafayette College, I'm Nisa Burmai with Bowden Saunders and Fabian Magursa reporting.
CRISPR will need to be further developed before its use in hospitals worldwide.
But some doctors are already thinking about ways this technology might be used for neonatal healthcare.
To gain a better understanding of future medical application of CRISPR-Cas9, we traveled to Hahnemann Hospital in Philadelphia to speak with my uncle, Dr. Harbhajan Chawla, who has been practicing since 1973. Dr. Chawla is a neonatologist with a specialty in treating premature babies who are more susceptible to genetic diseases like hemophilia.
There are many genetic diseases that could be fixed if CRISPR ever works. For example, if I know a patient, say hemophilia, if I know what the gene is there, and if I can split the gene off right from the embryo and then put a new gene, I may have a baby with no hemophilia.
Dr. Chawla currently relies on stem cell research, but sees many similarities between CRISPR and his current practice.
In theory, I think CRISPR will work very well. Stem cell still is in the baby stage of research. To say stem cell is very safe also is not right yet. CRISPR is still in the same theoretical phase of it. I think it has to prove itself before it can be used on human being.
Although Dr. Chawla believes that CRISPR is still years away from being used in his practice, he is excited about the rapid pace of research.
I always underestimate the time it takes, Whenever I started first, I said, oh, this will not be ready for another 6 months or 6 years, and bingo, in 1 year something comes up.
For Lafayette College, I'm Sanpir Chawla with Adam Hoppus and John Hyatt reporting.
One often overlooked application of CRISPR-Cas9 technology is in biofuels.
Our reporters explored these possibilities with Lafayette College professor Lindsay So.
We met with Professor Lindsay So, a chemical engineer, to learn how CRISPR-Cas9 technology may affect the production of biofuels.
So specifically, I have looked at trying to make biodiesel as a product, and looking at taking different types of oils and converting those directly into biodiesel.
The viability of biofuel depends on the cost of producing it, which determines its price compared to other fuels.
Most of the cost associated with biofuel production is associated with the feedstock itself.
This means that CRISPR-Cas9 could be used to make algae cheaper to produce. The entire process becomes more likely to reach a point where it would become more profitable.
Basically, you can take these algae and you want them to accumulate the lipids, right? So the lipids are what's useful to extract out and make biodiesel. So if we can get them to accumulate lipids at, maybe even up to, it's been proven up to 80 or 90% of their cell mass, then that can be something that's really helpful.
Aside from raising lipid concentrations, there are more ways in which CRISPR-Cas9 could be used to make better algae.
Other properties that could be improved are its ability to grow on different types of feedstocks, or its ability to grow densely in terms of its culture, so having lots of algae grow in a small amount of space, or its ability to basically be resistant to different types of contamination.
Overall, it looks as though CRISPR-Cas9 has the potential to make a significant impact in the field.
I think that there can be huge advancements in maybe the next 10 or so years that can be done with this technology.
From Lafayette College, this is David Beezer, Han Lee, and Kyra Lier reporting.
With the emergence of agricultural applications of CRISPR technology, the debate about the safety of genetically modified food continues among health experts.
According to the Center for Food Safety, in the U.S., roughly 75% of packaged foods are genetically modified. We interviewed Kim Howie, a certified health coach specializing in nutrition in the Lehigh Valley, to get her perspective on the effects of GMOs, CRISPR-Cas9, and what consumers need to know.
What we're noticing is there's a huge rise in different diseases in terms of our digestive system, in terms of hormonal issues, infertility, and allergies.
The Center for Food Safety reports that 64 countries require GMO labeling. The United States and Canada have no such regulation. Howie advocates for more research.
I don't want to be a guinea pig. I feel like we're already involved in a giant experiment right now.
For another perspective, we traveled to Washington, D.C. to speak to policy analyst and microbiology expert Dr. Ian Simon.
CRISPR-Cas is a tool that introduces the same types of edits and introduces the same type of engineering, but does so at a higher frequency, does so with higher fidelity, does so at a cheaper cost.
We asked Dr. Simon about his thoughts on public fear of gene modification.
I don't think the public should be alarmed that this is going to enhance or advance science past the point where society can grapple with it. It's a new tool, but it's not deploying any kind of new advances that we don't know how to handle.
For Lafayette College, I'm Danielle Cedillo with Tori Almeida, Caroline Bitterly, Maggie Carver, Aaron Sincata, Lisa Diarra, Sean Hogan, and Lizzie Solk reporting.
For our full interview with Dr. Jennifer Doudna, visit policystudies.lafayette.edu.
Thank you for joining us for the inaugural edition of Open for Debate.
This program is recorded at the PPL Public Media Center at PBS 39 in Bethlehem.